Hello everyone, today I'm going to show you how to evaluate a low vision patient. I have a patient who has a proliferative diabetic retinopathy. She is a middle-aged woman and her occupation is she is a makeup artist. So let's start the assessment. So the basic thing which we do in low vision assessment is the review of her earlier case paper. So we have to, in detail, we have to take the history of the patient, like what disease she is having, since when, and what are the medications she is taking for it, what kind of surgeries or treatment she has given before. Also, we have to record the earlier distance visual acuity and the near visual acuity, and also the visual field. Next thing is the interview. You have to ask the patient what are her visual needs, or what is the expectation of her from us, whether she is cooking or not, whether she is driving or not, how she has come alone or she has come with somebody. Ask her about the social interactions, so that we comes to know whether the patient is socially active or no, whether she is kind of in a depressed state because of her visual problems. So all these things we have to note it down very carefully. Also, we have to ask about her mobility issues, whether she uses cane or not. Also, while doing the interview, we have to observe the patient, like how she is talking, whether she has some behavioral issue like psychiatrical issue, or you feel like she's in depressed state, or while looking at you she is bending her head so that she can see you clearly. After the interview is done, you have to do the basic external ocular assessment, like the ocular motility or the alignment of the visual axis, and also the pupil reaction. After the ocular assessment, we have to do the contrast and glare assessment, also the visual assessment, distance vision and the near vision assessment, monocularly and binocularly, and with pinhole and without pinhole. We have to note it down. After all the assessments are done, we have to do the refraction now. First, we have to do the distance refraction. We have to attain the best corrected visual acuity possible for the patient. After distance refraction, we have to do the near refraction. Near refraction, we have to do the monocularly as well as binocularly. We also have to note at what distance the patient is seeing the near vision chart very clearly. Now you will get the final prescription power. Since my patient is a diabetic patient, so I recommend her to go for a tinted glasses, because she must be having photophobia due to the proliferative diabetic retinopathy. I also suggested her Stein magnifier to read certain things. She said she is not kind of in reading, so I suggest her for the Stein magnifier in case she wants to read anything. Other than the optical devices, I also suggested her non-optical devices, such as like the room lights should be dim, not dim as such, but it should be not too bright because of the photophobia, and she might get discomfort. So ordinary room light would be fine for her to be more efficient. Then she can use yellow sunglasses or filters to increase the contrast, which is very helpful under the low light conditions since she is a diabetic patient. Also, she can order the labels for the kitchen supplies so that it can be helpful for her in the cooking area, and also if to take her medicines, she can use the marked syringes or the marked boxes to keep her all the medications, tablets and everything. Also, with the final power, she can able to read 636 parts, so it won't affect her occupation, which is she's a makeup artist, so it won't affect her that much. But she can always use yellow tinted glasses, so that to increase the contrast. And finally, you have to tell the patients about the government policies, if there is any, which are helping the low vision patients financially, and also you have to tell them about if you know about any NGOs which are also helping or supporting the low vision patients. So you have to keep following the patient, do the follow-ups regularly, and know the success or success of what you have provided to the patient. Thank you.